Hey everybody, welcome to another exciting episode of Clinic Gym Radio. I'm your host, Dr. Josh Satterlee, and I'm joined today by Dr. Aaron LeBauer. Aaron, how are you?
Hey Josh, I'm doing great. Thanks for having me on the show. I really appreciate it.
Awesome. And Aaron, you are a, what do they call that? A guru within the world of physical therapy, but specifically for what you call the cash PT world, right? Those that want to kind of break free of the chains of the hospital systems and health insurance and kind of build their own clinic up. Is that right?
Yeah, that's basically it. You know, I don't have a retreat center, so I wouldn't call myself a guru yet.
There's no sweat lodge out in your backyard or anything?
No, there's not.
All right. Well, okay. Well, we'll call you.
I mean, the whole idea is to not be handcuffed or influenced by a third party when I'm trying to make the best decisions for my patients.
Yeah. I love it. And Aaron, you and I have talked a couple of years ago, but since then you have done some amazing things, including you recently had a conference virtually. Can you share us a couple details about that?
Yeah, we had a conference called Physical Therapy Business Conference, or PT BizCon. It was an idea I came up with a couple of years ago, and last year, 2020, we had 160 something people come into Charlotte, and a week before, COVID came first, and we had to move it virtual. Enrolled another 25 people because it was now virtual. And I would call that a success because, we actually made money on it, versus like what a lot of in-person events. Sometimes you're like, if we break even on the event, we're good. But this year we did it all virtual. And because we're not meeting in person yet, or I couldn't plan on that when I had to make all the plans back in January. And
sure.
We had another 186 people get tickets for the virtual event. Almost all physical therapists, some other professions, and it was a lot of fun. It was a tough 2 days, but it was a lot of fun seeing people get results. We had people getting new patients just from some of the strategies I was teaching during the event, so it was pretty neat.
That's awesome. I always love when you go to conferences and somebody's like, "Yeah, I did this. I actually implemented that last night in my hotel room or whatever." And it worked. I got 6 people or, and you're like, oh, wow, it works that fast if you take action, right?
Oh yeah. I did this one thing where I paused for 5 minutes. I said, okay, and I'll go post this on Facebook or Instagram, whichever is your preferred platform. And I put a little 5-minute timer down, and we had people with massive results within an hour by the next break. And even by the end of it, some people were like, oh, I didn't get any results. And then the next day they're like, the post blew up overnight.
That's awesome.
I love it. It's really cool.
Yeah. Well, and it certainly proves why the hell they came there, right? Like,
I hope so. That
before that's over, I'll already get your results. Yeah.
That's right. I mean, I want people to see, and you probably know this too. You got to get results like quickly, or can I get you a feeling of results? Because we both know that the problems generally take more than a couple days or months to really solve. But can I get you getting some wins right away? And I like it when I go to conferences and I get wins. My goal is to, host events and courses and conferences to get people wins early and long-term.
Yeah. So you've been doing this for a few years now. You've had the conference this year, last year, and I know you and I spoke a couple years ago, but what trends are you seeing in the world of physical therapy? I mean, we got some physical therapists that listen to this podcast. I think, most of the listeners are chiropractors, but we got some strength coaches and personal trainers in there as well. But what trends are you seeing from the business side of physical therapy?
I think the biggest, besides like people using telehealth or not using telehealth, which was kind of almost a last year thing, I think the biggest trend that I'm seeing is more and more physical therapists opening their own businesses who are feeling like they are able to and have the tools to access to be able to do that, and more bigger in-network clinics like being combined into larger, like some of the larger brands or networks. And so there's like a split. I think there's less medium-sized businesses, and
so it's kind of like a dog bone. You have a bunch of one provider offices, maybe with some support staff, but one provider. Not many of the 2 to 3 people partnering up, and then you have the hospital-owned 20 provider clinic.
Owned, like 20 provider or more, multiple locations. And there are cash practices now that are scaling up to, a handful of physical therapists, 3 to 5 in the last few years. But I think what's really hard is when someone has one location and they're in network they're really struggling because I've worked with a couple people even in the last 6 weeks who their cost to provide the treatment is higher than their average collections.
Yeah. And I think that's in all, I hope everybody knows, like, that's not just a PT or chiro thing. That's, right. I have a friend who's a MD out here, and there's a Medicare, I can't remember what service it is, but let's say it's blood draw. He gets paid $18. He has to pay LabCorp or Quest $23. So he's already out $5 hard dollars, right?
Right.
And he says the only reason he runs it, though, is if the test is positive, then he can bill Medicare for the treatment. But he said probably a third of them are negative, and therefore he loses the entire that $5 on all the negative ones. And I'm like, this is unsustainable for anybody.
Right.
You know?
Right. It's crazy.
Yeah.
It's really
yep. And he's said the same thing that you are. Like, he's been approached a bunch of times about, hey, you should join our physician group. And he wants to stay independent, but it's getting harder and harder and harder for people to do that.
Yeah.
So,
and I've had physicians I know who, want to stay independent so they can spend the time with their patients, but they just can't make it work financially because of, like the labs. And they go and they join like the larger hospital group, and they're great, but they get like 4 minutes with each person, and you lose that special, I don't know what it is, like relationship that you have with someone you can actually call anymore, or talk to or ask a question to without getting an operator in Iowa.
Yeah.
When it's your health, it's like, that really stinks.
Yeah. And it's the health of the patient, but it's also the way you want to do things as a provider. I think it's like artwork, right? Like, you want it to be your version of it. Like, there's a lot of different art that's beautiful, but you want this to be yours, not anybody else's. And it's tougher and tougher as we move forward. So you host some conferences, you have a mastermind, you have different ways of people getting kind of involved. And it really comes down to, and I would love to talk about this, if somebody wants to spend that time, if they want to operate outside those handcuffs or restrictions, at its core, what changes do you think most providers have to make? Because in my gut feeling is these providers are super smart people that have gone to a lot of school. They're diligent, they're hardworking. I think that what has kind of created this moment for you is you're a total rebel at your core, right?
Right. I think, I mean, what is it? The thing people have to do is that you have to get over yourself, right? And understand that you're probably not charging enough, or you're trying to convince people to buy your services instead of actually selling. And then people go, but I don't want to sell. Well, if you think sales is sleazy, you're asking the wrong questions, and you're learning it from the wrong people.
So you're saying at PT BizCon every year, there's not the keynote is not certifications that you should have to be able to make money in this business.
Right. Absolutely. There's nothing about certifications. Anyone that asks me if they're going to get Con Ed credits for attending, I don't really want them there.
Interesting.
Yeah.
And so when you go to the selling part, because I think, I have clients that struggle with that as well. Heck, I can't say that I've never struggled with it. It's hard to sit in front of somebody and say, this is what you need. I just had somebody yesterday put together like a awesome plan. He says he's totally interested in golf. And he says, well, I don't think I can come that many times. And I said, this is what I think is best, man. If you want to select out of those, like, that's fine. But I'm just telling you what's the best. And then he said, well, do you think I need them? And I'm like, I just made a case why this is the best. Like, in my mind, I'm going, yes, hence everything that I just told you over the last 10 minutes and all the results. Like, yes, I think this is the best.
Right.
But it's, people still struggle. And me as a consumer, I do the same thing, right? I don't just say yes to everything. So it's a reasonable stance, I think. But going back to that, what tips do you have for some folks that are in the clinic to help them approach sales differently?
Yeah. Sales is number one. It's about asking questions and asking permission. So it might be, hey, Mrs. Jones, tell me what's going on. Okay, great. And you get some information from them. Why is this important to you to solve this problem? And maybe even before you ask that, is it okay if I share with you or ask you some questions to see if I can help? Because it really doesn't, because I would say this, to you and me. I don't usually say this to patients, but it doesn't matter whether I take insurance or not if I can't help you. So I've had patients really press that. I say, well, Miss Jones, can I ask you a few questions just to see if I can help? And then this one woman said, no, I just need to know if you take insurance. I said, well, if I can't help you, does it really matter whether I take insurance? She's like, well, I guess not. So what we really have to do is we have to ask permission. Like, is it okay if I ask you questions to see if I can help? Is it okay if I ask you questions to find out what's going on? Great. Okay, now I ask some questions, and it's more like, Miss Jones, I help people with this all the time, just like this last patient, Jennifer. I know I can help you. Is it okay if I tell you how? And so now what we've done is we've just asked permission along the way to then tell them how or ask them more questions. And then once we do that enough, now I'm not telling them what they need or trying to pull them along. I'm asking them, and they're bringing me with them. It's kind of like, they're like, yes, please come with me. And so now it's permission-based, and they feel good about it, and I'm not trying to like coerce or convince.
I love that. And for those people listening, if that just totally made them warm inside and tingly, like, oh yeah, I can do that. Do you offer coursework around this, or how can they learn this method or refine this method?
Yeah, it's great. I would say, well, number one, all my mastermind members, I put them through a course I created called Ethical Influence, but it's not something that's just for sale. But the best thing to do would be to, listen to some of the podcast episodes I've done on sales. But one of the sales masters is Jordan Belfort. His book, Way of the Wolf. He's the Wolf of Wall Street, but he wrote a book, The Way of the Wolf. And I wouldn't even read the book. Go get the Audible version because he narrates it. And the tonality that he teaches and uses is way too important to read. You should listen to it.
Oh, I love that. Yeah. Say the name of the book again.
It's called Way of the Wolf by Jordan Belfort.
Okay. That's always good. Yeah. I've been around a couple master salespeople in my life, and man, they make you feel really good about what you're doing. I would say that's one thing. They don't make you feel like you're being taken or sleazy. Mm-hmm. They make you feel like you've been right this whole time, and thank God you're here, and you're just like, yeah, that's right.
I was at an event where this guy, Joel, Joel, Joel Weldon, was selling his course on speaking. It was like $1,000 course to about 1,200 people. And he got a standing ovation for his pitch. He pitched a course and he got a standing ovation. And I'm looking over at my friend and I'm like, he's pitching us, right? He's like, yeah, I know. He's writing down his credit card number. I mean, if you're doing it right, like it feels like you should be getting an applause rather than people like squirming away from you.
It's funny now that you mentioned that. I remember I took I don't know if you ever heard of Sandler sales training, but it's just a systematic sales training. And so they always say, like, if you run into any problem, just start asking questions. And they kind of have these, why, the 5 whys. And so this guy says, I don't think that'll work with my clients. And I remember the guy up on stage is pointing to he has the 5 whys written on one of those flip charts. He's pointing to it. And he says, why don't you think that would work? And the guy says something and he writes down the answer. And he says, so why that? And the guy's, well, they blah, blah, blah. Like he's literally going, and the guy can see him doing it, Right. And at the end of it, he goes, so what do you think's going to happen? Like, where do you think we should go for this? The guy in the crowd is like, well, I guess, I guess I believe you now. And everybody is looking at this guy like, you understand like what is happening right now, right? Like right. It was just so ironic, but it works. So why not do it?
Yeah. And that's definitely part of what I'm talking about in teaching it. Like it's that you have to find out why is it important to them, but it's not just why is it important to get your knee back, fixed? Why is the activity that it's not just, okay, the knee keeps me from going to CrossFit or lifting at the gym or squatting. It's why is squatting important? Okay, because it helps me relieve stress. Why is relieving stress important? It's because it helps me feel like a good role model for my kids. And you got to get to that real reason. And it's such a brilliant strategy.
Nice. So what drove you nuts about the PT world that got you to this point? I mean, it takes a lot of effort to put on conferences. It takes a lot of effort to host these groups and everything. Yeah. What was it that just drove you so nuts that you want to do this?
Yeah, there are a couple things. I think number one was I was told I can't do it. That's probably at the core of it.
Yeah. My wife has a specialty in radiology, and she got it because one of her the head instructor was like, you're not gonna be able to do this. You can't.
Yeah.
she's like, okay, I will now die before I don't do this.
Right. Right. So there's that. So it was like, but the first problem was, when I was a massage therapist in my, I wouldn't say my first career, but before PT career, I was a massage therapist, and people were saying, Aaron, you're the first person to touch me where I hurt and to help me. I've been to chiropractors, acupuncturists, physical therapists, orthopedic surgeons, had the surgery, massage, and everything. And I'm like pressing on like the quad or a hamstring or something. Like, no one touched you here? No. Is that where it hurts? Yes. Okay, great. Let me press on there for 5 minutes. Oh my God, it feels so much better. Okay. So as a massage therapist, I saw that, okay, if I spent time touching people, they were getting something that they weren't getting. I get into PT school so I can learn more prognosis, diagnosis, and deepen my knowledge, and to be Dr. LeBauer. And the professor goes, patients only need 30 to 45 seconds of hands-on care. And I'm just like, no, they don't, because I made my career on people like that. And she was like, whoa. I was like, I'm not going to let that one go. And I just saw that, okay, on my first clinical, I saw 43 patients one day, and that we're seeing 4 people an hour. I'm like, this isn't going to let me treat patients the way that I know they need to be treated. So I'm going to have to do it on my own. And people go, you can't do it. You shouldn't do it. It's not going to work. And I said, well, let me try. And I'm going to show you it's not. So to fast forward to why all the conferences, why go through the effort, is because people told me I couldn't, but I figured out how to do it. And so can I help 10 other people or 10,000 other people do the same thing when everyone else says it shouldn't be done or can't be done? And if I can do that, then we get to help more patients avoid MRIs, surgery, and all the fear that comes after that.
So that sounds like the clinical version of it, but my gut instinct is that something else was driving you nuts about this psychologically.
Yeah. Well, is it
the control thing? I mean, is it like, you seem like a dude who loves freedom. Like you love, it just appears like when I've listened to some of your podcasts, I follow you online, and it seems like freedom is a big driver for you. Like, did you recently take your kids camping or something? Yep. I remember this.
Yep. Yeah. I just went camping this weekend. Yeah. And that's the other thing is like, I don't want like a boss hovering over my shoulder. I want to be able to do things when I want to do it. Even if that's work all day long or go on vacation for 2 weeks off grid. Right. I want to be able to do it when I want to do it. And helping other people. Well, I can do it as a clinician in my practice, and I can do it as a business coach. It's just about like the systems that I set up that and having that as a goal. But yeah. And, I think that the standard thought is that you're going to get a job and you're going to work 8 a.m. to 5 p.m. or 6 p.m. or maybe a little longer doing your notes, and you're going to ask for time off, and that doesn't work for me.
I think that's interesting. I mean, that's definitely something in the world of PT that we don't really have in Chiro is, every PT I've ever met knew that they could always work for some hospital system or, getting hired right out of PT school. And it would be like your junior therapist slogging away, seeing 4 people an hour. Some of them would tell me that they were scheduled for 6 or 8 people an hour in a group setting and figure out a way to get it done, but that idea of creating your own thing, I think is prevalent in, I think chiropractors in general are a little more independent. Like,
right.
They don't want
to go into it knowing that like, there's not a job waiting for me at the hospital.
Yeah, that's right. Yeah.
And I think we have physical therapists have a lot to learn from chiropractors. I mean, first person I saw marketing a therapy business was a chiropractor in San Francisco. And I was like, oh, wow, look at that. Like he was, I don't know, he was I was riding my bike, as a messenger. It was a year I was a messenger, and he was handing out, coupons or flyers as I rode by where his clinic was. But yeah, I think you're right. Like, I think chiropractors attract I wouldn't say a slightly different, but a slightly different mindset from the beginning. Like, one of the hurdles I have with physical therapists is they're like, oh, I never thought I was going to do this. So I never thought, I didn't get into this to start my own business, and I lost my job, or I'm not making any money. And chiropractors go into it knowing, okay, here, like, these are my options. Probably 10% of us go and can work for somewhere else in more traditional medicine. And 90%, we got to go start our own thing or work or partner with someone who's doing it independently. And I think the starting point for each is valuable. And I think chiropractors do a great job at them, like a lot of the marketing sales pieces that we just don't start with.
Well, that's good to hear. Yeah, I think we have been served by that in the past, but I think it's weird. We're kind of leaning away from that and leaning towards more of what the PTs have been doing. Mm-hmm. It seems in some ways, not the big hospital groups. Although there's like a Facebook group now for hospital-based chiropractors. And I'm like, oh, well, and there's over 1,000 people in it, which is funny. I'm sure you're like, you're ready to throw yourself on that grenade. Don't do it. No.
Well, anytime massage therapists are like, oh, we need to get, get massage covered by insurance. I'm like, you're crazy. You're just looking for legitimacy of the profession. But
you see that in stem cells, like the stem cell physicians are all like, no, we do not want insurance to cover this. We absolutely do not, because, if they've been in the game long enough, they see where that goes within 5 years, and the devaluing and all that stuff. And it's just bad news. Keep it off label. And
I think it's the worst, one of the worst things that could happen to something new. I think it's, I know this physical therapists come out, and the ones that struggle the most in figuring out how are they going to grow their business are thinking in terms of, I'm charging $75, $80 a patient, one person an hour. I'm like, well, they're like, I got to see 40 people a week to make $100,000 a year. I'm like, you're thinking in wrong currency.
Yeah, that's the other thing. When you financially planning your life when you're a broke 23-year-old in grad school is a horrible outlook. Right. That lens needs to be refined multiple times, It does. It'd be like that show Wife Swap where, you switch places. It would be great if you switch places with some, attorney or accountant that's got 3 kids, and just look at how many checks or how many outgoing bills you have between sports and housing and food and we're not talking flying private and driving the nicest Lexus you can, man. We're talking about just a good life.
Right. Well, not even the nice Lexus. Well, it's the Range. I've realized recently the Land Rover Range Rover, you can buy one like retail for like $180,000, and then you can get the $300,000 custom version. And I was like, I didn't realize those were that expensive. Those are crazy.
Like somebody looked at that and said, oh, this is nice, but just not nice enough. Let's start cranking up the dollars here.
Yeah. But
I mean,
Josh, I was just saying, like, I think what's interesting is, and I'm not 100% sure chiropractors have this same issue, but I went to the dentist and they're like, oh, it's going to be $1,800 for X. You go to the lawyer, you ask for help, and they go, okay, it's $1,600 for this, it's that. And as healthcare providers, maybe there's an innate, ethical, stumbling block where we're trying to help people with their health, not a widget, and we struggle to charge what we're worth because it's a service, not a procedure.
Yeah, I think that is an interesting outlook, because I do notice that any time that you have to involve an outside contractor, so going back to going to the dentist and getting a retainer. If the retainer costs the dentist $1,000, he's much more firm on his price because he has this hard cost.
Right.
Whereas when you're selling time or service and you're like, the massage therapist will go over 3 minutes or 5 minutes all the time, not realizing that should be an additional $12 or $18, whatever, because it's like, oh, that's just what I do. And that time is super valuable and frustrating, man, because it's limiting to one-on-one. That is so restrictive of the model, which is why I advocate, get these people into exercise and do that in group. I don't want people thinking that you should go from one-on-one clinic care to one-on-one exercise, because you realize very quickly, being a gym owner, that is a limiting business model as well. Oh, so go for four people for one coach or more. That's really where it starts opening up.
Yeah. Some of the best marketing I've done is I also am a yoga instructor, and I did like a back pain workshop. I had 30 people. It was an hour and a half workshop. I think we got 2 new patients before the workshop started and 4 new patients from the workshop. Plus it was like a 50-50 or maybe a 60-40 split. On my side, I made $500 that day, and it was group. And I can know, okay, here's the injury you're coming in with. I know how to modify, to keep them safe, even with 30 people. And I hadn't at that time, I'd only been teaching yoga for probably 2 years or maybe a year, and had been a PT for 6. Okay, that's not like, it's just a little bit of experience, but the skill is one we already have. We just have to see it, that it's possible.
Yeah. So, what are some success stories you've had in your group, like from last year's PT BizCon or anything like that? I would love to hear when people make this breakthrough, because when you hit that perfect match of like a good business model coupled with somebody who is just beat down, angry, pissed off, and then finally their boss comes in to say something or do something that tips them over the edge.
Yeah.
It's amazing what a human being with a little bit of training can complete in about 3 months,
Yeah.
Hell, 3 weeks sometimes.
Yeah, I think there are a couple that come to mind. One is one of my clients, Ben Baggy, had right out of school kind of stumbled into a cash practice. And he was like, oh, wait, this is kind of working. So then he started working at it, and he made 6 figures his first year, living in the Bay Area, and then decided to, grow it. He'd never really wanted to grow it there, but he wanted to move back to Iowa. So he grew it to 3 clinicians, and they were doing like $45,000, $50,000 a month. Then COVID hit, and with the strategies and things that we put into place through COVID as it came along, they didn't lose any revenue. They got a PPP loan, which covered like their initial any dips, but they really didn't lose anything and continued growing. By that summer, they were at $65,000 a month, and this is gross revenue. And he had removed himself from treating patients, moved to LA, hired someone to see people down there, spent 2 months there on vacation, moved back to Iowa where he started his 3rd location. And that was almost all through COVID. Another client, Julie, was struggling to like relocate her practice from Memphis to outside of Seattle, put in the marketing strategies. And right now, today she's like, I'm so busy, I can't, she's got a waiting list. But she also doesn't want to see, 30, 40 people a week. She sees 4 people a day. Majority of the time, her husband's like out of town for work. And she climbed Mount Rainier last summer. She's going to climb one of the huge peaks, I can't remember, in Alaska this summer. And her problem is she can't, accommodate all the requests she's got. And this is all through COVID. And she's making she was doing $16,000 a month, seeing 4 people a day, 5 days a week. Something like that, part-time, hanging out with her daughter the rest of the time.
And you really create some lifestyles. Like, I mean, that's what I'm hearing there. Like if you want to hire 3 or 4 people, that's an option, right? Like your guy that moved to LA, or if you want to just work, seeing a few people a day, but living your life. I would, it's probably advantageous for you too, because you don't end up with a conference of just a bunch of burnout people. Like I have a friend who teaches for MedBridge. I don't know if you know MedBridge.
I know MedBridge, yeah.
For those listening, it's like in the world of PT, it's got to be one of the biggest CEU providers of anybody, right? Mm-hmm. And he says that the worst groups to teach, do like live webinars and stuff, are like hospital-based, overworked PTs, because now you're taking an hour or 2 of their life as well. It's like it's miserable. And I'm just picturing you at your conferences, like everybody's got their they got their feet up on their desk, like, hey, I can fly out tomorrow or not. Hey, you guys want to go-kart racing? Like, let's do something fun. I got people to cover me. I got a good income. I'm living the dream. And that's one thing that certainly doesn't get covered in grad school nearly enough, is quality of life.
Right. No, it's all about do, get an A. Yeah. If you're not getting 100% or an A, like you're not good enough. And
right. That'd be the other great thing, Aaron, is like I would love to know the average GPA of your most successful clients, because
I know it's probably.
I just don't think they're valedictorians. Like,
no.
Yeah, they're, because those are rule followers, right? Like it's fantastic.
I'm not a valedictorian. I was 1,250 out of 1,600 in my class.
Yeah, I was probably a similar place. Like my wife had ropes around her neck at graduation, and I was like, "Where'd you get those things?" I didn't know they had those. She's like, "Well, it was in the honor society." Huh. No one ever called me.
I was walking down the campus, like the quad, with one of my best friends and his good friend. Sam was 6'4", Lex is like 5'3", and Lex goes, "Aaron, did you take your resume to the resume drop?" I'm like, "What the fuck's a resume drop? I don't know what that is." He's like, "Oh, it's where you take your resume so that all these companies can hire you." I'm like, when did that happen? He's like, "Oh, it was last week." I was like, "Can you still do it?" He's like, "No." I was like, "Well, I guess that's it."
Yeah. Well, you've done okay now.
I think I'm doing all right. But it was just like those things just like they never registered.
Yeah. And it's a good thing too, because like at some point too, I'm always shocked by how much of our life is just what you think the next step should be. And you never step back and say like, should I take that next step? You know, it's like you go to some CEU certification and the second day of the weekend, they're talking about like what level 2 is all about.
Yeah.
People just think, oh, I should sign up for that, rather than like, am I even using level 1 in my practice? Like, is this something I see? Like I've taken a lot of, I can think of a soft tissue course I've taken. There's probably 1,600 protocols in the thing, of which I've used, I'm going to guess 100 of those protocols for 98% of my clients. The remaining 1,500 I've maybe never used.
Yeah.
And I don't need level 5 because I'm not using all level 1, you know?
Right. Yeah. Same. There were some courses I took. I was like, well, I couldn't possibly go to number 2 until I practice this, you know, and integrate it into my practice. And so I went to like 1 a year. Even with dry needling is one of the latest things I've done. That pretty much, it's been a while, but there's probably 6 muscles that I needle, but you'll learn like all 150 of the major ones.
Right.
You know,
Yeah.
like, you know, infraspinatus, maybe quad, little gastroc.
Right. And then they're like, oh, here's how to do the, you know, peroneus tertius or something. And you're like, my thing is always like, there's a peroneus tertius?
Yeah. Like, I didn't know. I was like, I can feel something here.
I was in a soft tissue seminar and I swear to God, they said pyramidalis. And I was like, you made that up. You made that up today. Like, that's not a muscle. Get out of here. And they're like, yeah. Yeah. Anyways.
What's the, I think, I can't remember the trivia. It was like, what's the smallest muscle in the body what's the smallest muscle in the body and maybe it doesn't articulate with any other muscle? Like the tensor tympani, I think. Right.
Oh, okay.
I can't remember what the question was. It was one, I don't know if it is the smallest, but I think it doesn't articulate near any other muscles. I think it's just in your inner ear. But anyways, for anatomy trivia, I'm not like, I don't know them all.
Yeah, I just picture you at the dry needle. So you can dry needle the tensor tympani? And they're like, no, you're mixing up 2 things.
Right through the nose. I think you get there.
Awesome. Well, Aaron, this has been a great time interviewing you. I'm glad what you're doing for PTs, because I think as your PTs get stronger in the cash model, so do chiros. For those people that might be interested in your next conference talking about this stuff or ready to make a shift in their practice, where can they learn more about you and what you do and hear more about these ideas? Specifically, I'll say the sales piece, because that's a game changer for anybody that introduces a sales process into their office, whether they're selling mortgages or healthcare, it improves everything, right?
Thanks, Josh. Yeah, it's the best place to find me is Instagram at Aaron LeBauer. My sales course is one of those ones where I don't actively sell it, but you can find it at ptinfluence.com, or if you're having trouble spelling it out, you could just message me, like over on Instagram, just message me, hey, like, sales or ethical influence, and I'll get you the details to that. But I think that, so I want to thank you for having me, Josh. And I think one of those interesting things that we talked about before you were recording is like, how do you tell the difference between a chiropractor and a physical therapist? Mm-hmm. Well, I feel like if you're doing the right job, you can't.
Yeah, I hope not.
Right? I hope not. And it's one of those things I've learned, like a few of the chiropractors that I've worked with who I was like, wow, I really get you. I was like, oh, you're a chiropractor? I thought you're a physical therapist. It's like, I think that if we're looking at the human body in ways where we're not looking at the injury, but we're looking at the person, and we are asking the right questions, and we're treating based on what they need and see the world as there are plenty of patients who need our help, then it's hard to tell the difference.
As it should be, as it should be. Great. Well, Aaron, I really appreciate the time today. And on behalf of my listeners, let me say thank you, because I think, again, what you're doing is really going to push all the people that want to stay cash-based and really have that freedom to practice the way you want to practice. Whether it's you want to spend 3 hours analyzing. I met a woman in a CEU course. She is a specialist in adolescent female gymnasts. She's a physical therapist. And I said, that's very specific. Congratulations. And she will do a 2-hour-long evaluation on the front end with about 40 minutes of that is just hand and wrist. I was like, wow, my God, talk about a master. But I mean, there's no way that fits into the HICFA 1500 form, right? Like it just doesn't. Yeah. And everybody that goes to her loves her, and she gets to practice the way she wants to practice, and brings a lot of relief to a lot of people who want it, and I think about how much she's improving those lives. So I know you're feeding the same fire that she's able to stay warm with. So on behalf of Aaron LeBauer, this is Dr. Josh Satterlee saying, go out there, maximize your license, and like Aaron helps his clients do, live the life you dream of. Thanks a lot, Aaron.
Thanks, Josh. Appreciate it.
Thanks so much for checking out these videos. I hope they're useful. We'll cover things like rehab, exercise, business model, progressions, layout, everything else that helps you build a clinic. So if you're interested, you can click here, there, here, or anywhere to get more videos just like this. Thanks a lot for watching, and we'll see you soon.